So abnormal vaginal discharge is characterized by changes in the color, the consistency, the volume, and even the odor of the vaginal discharge.
Wow.
And it can be associated with some symptoms like itchiness, soreness, amongst others. If you haven't watched my previous video where I talk about what you do not know about vaginal discharge, then do click on the link. It has lots of information on what is normal and what is not. In this video, we are going to look at the causes of abnormal vaginal discharge. So don't go anywhere, stay tuned. Abnormal vaginal discharge can be caused by infection and can also have a non-infectious cause. However, the most common type of abnormal vaginal discharge we see are caused by infection. And research tells us that about 70% of the abnormal vaginal discharge are caused by the bacteria vaginosis, the vaginal candidiasis, and we also have the trichomoniasis. Okay, so I would insert a table that would give a summary of how they all present, with the ones that you should further test for additional STIs amongst others. Okay, bacterial vaginosis presents with a thin discharge. It has a fishy odor. There's no discomfort or itch. There's also no inflammation of the vulva. And when it comes to the need for testing for other STIs, you may want to consider women with risk factors for STI. So for example, women with multiple sexual partners, and there's also no need to treat the sexual partner when it comes to bacterial vaginosis. When there is a change or a disruption of the normal flora or ecosystem of the vagina, the imbalance of the bacteria can lead to bacterial vaginosis, and it mostly occurs in people who are sexually active. You also have a higher risk of getting the bacterial vaginosis when you have the IUD, or you have multiple sexual partners, or a new sexual partner, or use douches. You cannot get bacterial vaginosis from toilet seats, hot tubs, or swimming pools, okay? Trichomoniasis presents with a scanty to profuse, sometimes frothy, yellowish, green-like discharge with a very offensive odor. There's an itch, there's also dysuria, and there's also vaginitis, that's inflammation of the vagina, and is associated with 2 to 3 times increased risk of HIV. So there is the need to test for STI, and indeed you'd have to treat your sexual partner when it comes to trichomoniasis. Vulvovaginal candidiasis presents with a thick white discharge, sometimes cottage cheese-like. It has no offensive odor. There's indeed vulvar itching, discomfort, sometimes pain in urination. The vulvar area is swollen, there's erythema. Indeed, there's no need to test for other STIs, and there's also no need to treat your sexual partner. So another cause of the abnormal vaginal discharge is the cervicitis. Cervicitis is an inflammation of the cervix, and the cervix is, the lower part of the uterus that opens into the vagina. I'll try and insert a picture of the cervix, okay? So anyone with cervicitis can present with abnormal type of vaginal discharge. It's mostly, purulent. And for people that present with cervicitis, the most common types of pathogens that are isolated are the gonorrhea and the chlamydia. Yes. And all these are STIs. When I say STI, I'm sure you all know sexually transmitted infections. It is also wise to know that it's not every woman that would experience the symptoms of cervicitis. You may be present with cervicitis, but you may not be having the symptoms. Okay, that is why once in a while, especially when you are sexually active and you have multiple partners, then you may have to go to the gynae and do a checkup, especially when you have painful sexual intercourse or you bleed in between your menses most of the time. First one that I want to talk about are the irritants, or the ones that can cause allergic reactions. So for that one, we have the perfumes. There are some sprays, vaginal sprays. There are some really strong scented vaginal soaps, douches, anything that can cause some irritation or triggers, especially when you have really sensitive skin. It's not even wise to be using whole lots of perfumes around that area, even though it might be tempting to do that to make the place smell nice. Okay, that is not good. It can lead to abnormal type of vaginal discharge. Okay. ladies. Another one is the presence of a foreign body. This is strange, but there are some people that can have retained tampons in there for several days or even weeks and months. Okay, so when the tampons are there and you forget, or I don't know what happens, but then there are some people that it gets stuck there. Okay, so for such people, you may have to go to the gynae and get it removed. Otherwise, it can lead to abnormal type of vaginal discharge. We also have some people that react to condoms, certain types of condoms, amongst others. So all these foreign bodies can lead to abnormal types of vaginal discharge.